Good to have the band back together. Dr. B here live. Whether you're newly eligible or you've had Medicare for years, there's a lot to learn about the program. Dr. B, good to see you. How you been?
Yeah, great to see you, Tommy. I've been doing well.
Nice to see a picture of those boxers as well. Tell us about People's Health.
Yeah, so People's Health is it's a company that offers Medicare Advantage plans here in Louisiana. And really our goal is to help people understand and enjoy their Medicare and all the benefits that are possible with those, rich plans that we develop that really try to focus on access to medical care.
I don't know if y'all change it or not, but every year when we come to 3017 Vets, it seems to get nicer and nicer and nicer. Do y'all change things?
Yeah, they do. They've decorated quite a bit, and it looks fantastic in here. I hadn't been here in a couple of months, and it looks great.
Let's talk about Medicare. What is it?
Yeah, so Medicare is the federal health insurance program, and it's designed for people that are ages 65 and older. But it is also available to people under 65 if you've got certain types of disabilities or if you've got end-stage renal or kidney disease. That's really the last stage of kidney disease.
And what else do we need to know about Medicare?
So Medicare is individual health insurance. So what that means is it doesn't cover your spouse. It's not going to cover any of your dependents. So it's different from all those employer-funded health plans. And the other big difference about Medicare is that it has 4 separate and distinct parts, and we call them by letters: Part A, B, C, and D. And each covers different services and has different cost associated.
Now, you're a physician. You probably just noticed my eyes glaze over.
Yes.
It happens. Let's talk about Medicare Part A. What is that?
It's hard to make it exciting.
But
it is important.
It is important because you have to make an active decision when you age in, right?
Exactly.
You can't just let it go.
No. You've got to be very proactive in this, and it is very confusing. That's why it's important.
So let's start with Part A. Dig in.
Yeah, so Part A covers, basically, the way I think about it, it covers facilities. So it covers hospital care and skilled nursing facility care. It sometimes will cover some home health services as well. So if you and your spouse have paid Medicare taxes for while you're working and everything, you do not have a monthly premium with Part A, but you may have a deductible or a cost sharing for certain services. So if you go into the hospital, you may have some cost sharing.
What is Part B?
So Part B, I think about kind of all the other stuff outside of facilities. So that's your medical insurance. It's going to cover visits to your doctor, outpatient care and procedures, and services like preventative care, things that are so important like your flu shots and screenings, all those diagnostic tests like blood work and x-rays and EKGs. And then it covers a lot of durable medical equipment. That's things like wheelchairs, walkers, hospital beds. And you have to remember, if you enroll in Part B, and you do need to actively enroll in it, you do pay a monthly premium for that. That's usually deducted out of your Social Security check.
So we've done A and B. What about C, Part C?
So Part C is actually Medicare Advantage plans. So that's the terminology for Medicare Advantage, and that's another option for getting your medical coverage. And so while original or traditional Medicare is offered by the federal government, the Medicare Advantage plans are offered by private insurance companies like People's Health. And those plans have to follow all of those Medicare rules, and they have to cover all the services of original Medicare.
So if you join People's Health or a Medicare Advantage plan, do you still have Medicare?
You absolutely do, and a lot of people don't understand that. You also have all the rights and protections that come along with Medicare, but your Medicare Advantage plan is going to provide the actual coverage for those healthcare services, and often all of your prescription drugs as well. And so at the doctor's office, or if you go to the pharmacy, instead of showing your red, white, and blue Medicare card, you need to show your health plan ID card.
All right, now what about Medicare Part D?
So we'll bring it home with Part D.
Bring it home.
So Part D is for drugs, okay? So that's your prescription drug coverage. And you have to remember, drug coverage is not available through original Medicare. You have to get either a standalone Part D plan that's going to cover your drugs, or a lot of Medicare Advantage plans include Part D in it. Those plans generally are required to cover the prescription drugs that are most commonly prescribed for people with Medicare, and they also cover things like vaccines.
And besides drug coverage, how else are original Medicare and Medicare Advantage plans different?
So original Medicare allows you to go to any doctor or hospital that takes Medicare. So that's anywhere in the United States. Medicare Advantage plans often have a little bit more narrow network. They may be state-based, they may be community-based, and they may have a network of providers or healthcare facilities that are considered in-network. Medicare Advantage plans may also require referrals for specialty visits and often require prior authorization for some medical services and maybe even those drugs that you're taking. Mm-hmm. And so prior authorizations just mean that you need to get it approved from your health plan before you go and pick something up, because that guarantees that it's going to be paid for. Original Medicare doesn't require referrals or prior authorizations.
So what about services? Do original Medicare and Medicare Advantage plans cover different services?
Sometimes they do, but I think the really important thing to remember is that Medicare Advantage plans have to cover everything that original Medicare does. So you basically, that's the baseline. You get everything in original Medicare, but then the Medicare Advantage plans might offer some additional benefits, and that could be things like routine eye care, and even eyeglasses, hearing aids, hearing exams, fitness center membership. They may offer transportation, and even an over-the-counter credit benefit. And those are things that Medicare itself does not offer.
I would think people may think that Medicare Advantage is more expensive than original Medicare, but not necessarily, right?
Yeah, not necessarily. Even though you get some of those additional benefits, because it is managed, they often do not cost as much as you may be paying for your Medicare. So your overall cost is what you need to think about. It's not just what you pay on a monthly basis. You have to think about the co-pays and the cost sharing and stuff like that. Medicare Advantage plans, another big point people may not understand is that they are required to limit your yearly out-of-pocket cost. And what that means is you can set a budget based on what the maximum is. Once you hit that maximum, you don't pay anything else, and that's not true with Medicare.
So to be clear, the extra benefits do not make Medicare Advantage more expensive?
No. The benefits might provide that extra value to you. So, an example here in Louisiana, the average cost of a dental exam, a routine dental exam, and that's going to include your x-rays and stuff, is about $220. If you have original Medicare, it's not going to cover any of those dental services because it doesn't cover dental at all, so you're going to have to pay that out of pocket. But if your Medicare Advantage plan has dental coverage, you won't have to pay that full amount, and often you don't have to pay anything at all because it's included. And you have to think about those savings that may add up compared to original Medicare.
Because all Medicare Advantage plans do not have the same costs.
Exactly. Each Medicare Advantage plan has different costs. Some plans may have a monthly premium that's in addition to the Part B premium that you have to pay the government. Others may have an annual deductible for medical services or your prescription drugs. So that means you may have to pay out of pocket before the insurance kicks in. And then they may have other costs for cover services, things like co-payments and co-insurances for seeing your doctors.
And why is that?
So Medicare Advantage plans typically have a copay. So what that means is it's a fixed dollar amount that you're going to have to pay. So if you go see a cardiologist, for example, it may be $30 with one of the Medicare Advantage plans, and you have to make sure that that you understand what your costs are going to be when you kind of calculate all the doctors that you need to see as well. So those are out-of-pocket costs.
So you're a medical doctor and you understand all of this. My goodness, your brain must be the size of a basketball. 8:22, we'll take a quick break. We come back, we'll talk about, give you some advice for listeners who have to make Medicare coverage decisions. We're live at the People's Health Medicare Center. Dr. B, our guest, 8:23, traffic now, WWL. All right, 8:27, Tommy Tucker back with Dr. B at the Medicare Center, People's Health Medicare Center, 3017 Vets. We're talking about on this first day of open enrollment. Doc, what is some advice you have for listeners who are making Medicare coverage decisions?
Yeah, I think the most important thing is people should know Medicare plans are not one size fits all. You really need to do a little bit of research. understand what your needs are, and even maybe jot down a list of questions that you have, because like we were saying before, this is very confusing
It
to a
can
lot
be.
of people. Yeah.
And what do you do next?
I mean, one thing that's really good is to talk to a Medicare expert. It's actually why we built this center. Gives you the opportunity to come in, sit down with somebody, and ask all those questions you have. Ask them how you can save on your Medicare cost as well. I found this out with my family. There are a lot of programs you don't realize that exist, and it can save you a huge amount of money, especially on prescription drugs.
What I think what y'all do here that's so good is it's trying to help a neighbor go through it online. It's one thing, but then to have somebody sit down with you and say, no, it's this, not that.
Exactly.
It's that, not this, because it can be misleading. How do you choose a Medicare Advantage plan that's right for you?
Yeah, there's a ton of different Medicare Advantage plans. If you go to Medicare.org or Medicare.gov and take a look at them, there's probably 20 on there. So you do want to look at a couple of different things. You want to check what the costs are and what the costs specifically for you are going to be. You definitely want to look at the coverage and make sure that everything that you need is going to be covered. And then you want to look at those extra benefits we talked about, things like dental and vision, and make sure they're things you're going to use. You don't want to pay for something that you're never going to actually use.
Some other things to do?
Yeah, so look at the plan's network. That's really important. If you've got a doctor you've been seeing for dozens of years, you don't want to have to switch.
Like Dr.
right?
B, for example.
Yeah, exactly. You got to be able to come and see me. And so you got to review the plans and make sure they cover what you need and everything. You also want to look and see if there are any special plans that may save you more money. That sometimes there are plans that are designed for people that have diabetes or cardiovascular disease, and that can actually give you extra benefits and extra value from that plan you're going to choose. And then the other thing is, word of mouth is huge. So talk to your friends, talk to people find out what they have and what their experience is. That goes a long way.
Why is it now the time to learn about Medicare Advantage?
So this is kind of the season. Right now it starts on October 15th and goes all the way to December 7th. This is the open enrollment period. So this is the one time of year where everybody can actually review their plan, decide what they want, and make a selection, and it'll become effective on January 1st.
Is this the only time you can make coverage changes?
In general, this is the main time to make changes. There are a few exceptions if you've had a life change, if you've left an employer, for example, or maybe you've moved to a new location, then that's an opportunity where you may be able to switch.
What about timelines and final advice?
Yeah, so this is really big, is don't wait until December 7th. You want to make sure you have enough time to do the research and you know what you're getting into. This is something you're committing to for the next year. You won't have another opportunity to change most likely until next open enrollment. So make sure you talk to people about what you should really be doing and that it's something that fits you.
And if you age in, again, going back to the proactive nature of this, I'm going to be a minute late here, but I think this is very important. You need to take the action that you need to take, because otherwise you could set yourself up for penalties that you have to pay for the rest of your life. Right?
Yeah, absolutely. So it's really important, if you're about to turn 65 and become eligible, start the conversations a couple of months before.
Do not ignore it.
Don't ignore it, yeah, because if you choose not to go into anything, then for every month that you don't go into it and you decide to later, you may get a penalty.
And you'll be paying that for the rest of your life.
Exactly,
So
exactly.
make sure you
Really
do that.
important.
All right, well, they're going to have a seminar today at 10 o'clock, another one at 1, absolutely free. People's Health 3017 Vets in Metairie. Come on out and see us. Dr. B, a pleasure as always. We'll talk to you again soon. Right now, we pause for news on WWL.